Welcome to the official podcast of the Ogden Surgical Medical Society. Since 1946, the Ogden Surgical Medical Society has been educating our medical community. In this podcast, we bring you the voices of medical experts in your community and from around the world. Please note that the opinions and ideas shared on this podcast are those of the speakers and not the opinions of the Ogden Surgical Medical Society or its board. While medical topics will be discussed, it should not be taken as strict medical advice, and individual clinical judgment is warranted in applying information to patient care. It is the responsibility of the listener to judge for themselves the applicability of the information discussed with regards to their medical practice.
Welcome, everyone, to the Ogden Surgical Medical Society podcast. And today we have an amazing experience to talk today with Dr. Simonian. She is the Dean of the College of Health Professions of Weber State University. And she's a huge supporter for Ogden Surgical Medical Society through a yearly partnership. And I can just say personally, Dr. Simonian has drastically influenced my life for the good. I am very much indebted to her, both professionally and personally. She's an amazing human being, and she's kind of like my mother. So we just appreciate her. And I know also, 10 of the students that I was with, that I went through with, and we all went to medical school in my age group. We are all very much. We have a lot of respect for Dean Simonian. And we really appreciate her. I'll look to her kind of as our mother. So, but as an intro, Dr. Yaz Simonian is a transformative leader in medical laboratory sciences. Her influence extends across academia, research, and health professions. As a dean and professor at the College of Health Professions at Weber State University, Dr. Simonian has advanced interdisciplinary collaboration, expanded educational access, and strengthened the connection between classroom instruction and clinical innovation. Under her guidance, the college encompasses 14 departments, including the School of Nursing, the School of Radiologic Sciences, and the School of Health Administration Services. She's also been instrumental with colleges in launching online programs in medical laboratory sciences designed to improve healthcare accessibility for rural communities. And we'll talk a little bit more about that. That's an amazing program. Now, Dr. Simonian's academic foundation was established at the University of Utah, where she earned a Doctor of Philosophy in Health and Patient Education. Her academic training spans the College of Pharmacy, College of Health, and College of Medicine, providing a multidisciplinary perspective that supports her leadership in health professions education. These achievements have empowered her to guide thousands of students and shape the future of healthcare through scholarship and service. Dr. Simonian's career began at the University of Utah Medical Center, gaining critical hands-on experience in medical laboratory sciences with a concentration in hematology. This specialization in blood-related diseases prepared her for a lifelong focus on cancer research, laboratory diagnostics, and the development of specialized training. Her commitment to advancing healthcare knowledge continued through her work in hematology research and education. She is a member of the Association of Schools Advancing Health Professions and a reviewer for their publication as well. Now, before assuming her role as dean, Dr. Simonian was the chair and professor of Medical Laboratory Sciences Department at Weber State University. During her leadership, she saw growth in programming and helped to elevate the department's national reputation. Moreover, Dr. Simonian has held many positions on boards and several prominent health organizations like the Leukemia Lymphoma Society, the American Cancer Society. These appointments reflect her continued dedication to cancer research and advocacy for patients and healthcare professionals alike. Her professional credentials include certification as a medical laboratory scientist through the American Society for Clinical Pathology. Dr. Simonian's career has been recognized with a range of prestigious awards, including various honors from the American Society for Clinical Laboratory Sciences and the Brady Presidential Distinguished Professor Award from Weber State University. That, I believe, is the highest award that a professor can receive at Weber State University, which congratulations on that. These accolades underscore her contributions to education research and the broader healthcare field. Dr. Simonian's service extends to the community through civic involvement and philanthropic work. She is an active member of the Armenian Apostolic Church in Utah. She has received recognition such as the YWCA Award for Education, the STEM Award for Utah Girl Scouts, and the Woman of the Year Award from Utah Business. Looking ahead, she intends to strengthen the current programs and continue developing new programs at the College of Health Professions at Weber State University. She will also deepen her support for advocacy for cancer research. So, with that, wow, Dr. Simonian, we are so glad to welcome you to this podcast. And really, a lot of us here in this community, this healthcare community, appreciate all of your work and support for us as past students, but also for the future generations of students. So, thank you, Dr. Simonian. We welcome you.
Thank you, Dr. Moore. That was a long introduction, and I'm honored to be here and in this capacity, and I'm honored for the partnership that we have with Ogden Surgical Medical Society and all of you in it. So thank you for that introduction, and I'm happy to be here and happy to help any way I can with our future students and our community health.
I'm so glad that we're doing this together today.
Yeah,
End of year, it's like the perfect end for your career and like the
it
perfect
is. It is. I'm kind
transition
of
to my career too.
a lot of different kinds of emotions.
Yeah, I can
Love my
feel.
job, but it's time to pass on the baton and have some other people have the opportunity to do what I've been doing. And we're in a good place.
Good.
Um, and so I'm happy. I'm
Good.
really happy that we have a lot of wonderful people around here that can do that. But they're doing a national search
Hmm.
and
Good.
they have to do that. So
Yeah.
we'll go with that.
Yeah.
Yeah.
Good.
Yeah.
Good.
Yeah.
Well, good. So you're at peace then.
I'm a piece.
Good. Good.
I
That's
have, I am so proud of all my graduates. I'm so proud of all the years. We started, uh, I started at Weber State in 1981, and our enrollment was 8,500. Now it's 35,000.
yeah, it's crazy.
Now,
Yeah,
just a minute. When
yeah,
I was at Weber College
yeah.
in 1961, the total enrollment was 2,000.
Wow. I was
Wow.
still in Iran. I wasn't here yet.
Yes.
Yeah. What we've done with OSMS has been great because we introduce our students to role models like who you have, and they can shadow. And we have increased our acceptance rates to medical school because of that.
Oh,
We're
wow.
higher than the national average of acceptance, and we're all proud of that. And in combination with College of Science and College of Health Professions, particularly medical laboratory sciences, the students get into medical school, they get into PA schools, and it's a great partnership. So I like that, and I wish it continues. And whoever takes my place will come and talk and show off what we have.
And I'll be there to ensure that it continues to.
Yeah, you do that. Yeah. So,
Wow.
maybe I should ask you a question. How did your education help you get into med school
Oh
and
my gosh.
continue with your life?
Yeah, so you are the big reason for that, I guess. Um, so I'll back up. I was a first year student at Weber State, not knowing what I wanted to do, and I'm like, well, I guess I'm just going to do biology or something like that because that's what every medical student does. And then I met you one day, Yaz, And
That was a
I
long
told
time ago.
it was what was it? 2004. No, 2003.
Yeah.
Uh, and I said, I want to go to med school, but I don't know how to get there. And I told you what I want, where I wanted to go. I was an EMT, and you're like, here's the deal. You gotta do this. You gotta do the MLS program. You're gonna learn this, the second year of medical school over 4 years of undergrad. And I thought, oh, that sounds pretty good. Let's do that. And being able to have that pathology understanding from the get-go was so vital to my understanding of all aspects of medicine. I mean, I'm sure Val can replicate that as well. Just knowing the pathologic basis of disease truly does help you to make sense in clinical problems. And it really just helped my thought process throughout. And I've taken that with me. Pathology was a huge gift to me that I didn't really expect to take with me, but I did, and I loved it, and it was great. Um, and it's made me who I am today. It's made me the clinician that I am today as well.
Yeah.
And so, yes, I have,
I'm proud of you.
thank you.
Before I came to Weber State, I used to be the supervisor of hematopathology lab at the University of Utah Medical Center. And I had the opportunity to teach the organ system, parts of the organ system in hematology. And I saw what difference that makes when we had students that were accepted from MLS Department of Medical Laboratory Sciences. And everybody wanted to be their partners in
Mhm.
the lab because they knew already they would open up a petri dish and go like, it's Pseudomonas. And the other ones were waiting with their probes to see what to do next. So they were all ahead of them. And it was really nice. It was a great combination to start the students with.
Yeah,
So that was good. Yeah.
I totally agree. It
Yeah.
was a win in my book.
Um, well, Dr. Val Johnson, Val, you were our medical director when I was the department chair in medical laboratory sciences, which was 12 years of that. And we started um, totally online programs because Intermountain asked us to reach to rural health. And we started with a BS in MLS online. And we had to figure out how to do the clinicals, how to do the labs, how to do all those things. And we were graduating about 24 students at a time from the whole department. Now we have 400 students online and about 120 face-to-face on campus. So it's been teamwork. It's been learning what to do with technology. It's been wonderful with our clinical partners. And so it has been a trailblazing kind of a thing that we've done. And I can't wait to see what happens next. Yeah.
Well, yes, I mean you were the front runner in that. I believe, and correct me if I'm wrong, but I believe Weber State was the first
Yep.
ever to offer that in the
We
world.
we were. We were first and we were everywhere. We even had students in our first graduate came from Guam. She
Wow.
was a spouse of a military person that was working there, and she had access to the lab, to the hospital. And she graduated, and we flew her in. And she stayed with me in my house, and I brought her to graduation. It was
Awesome.
such a proud moment. It was great.
That's so cool. Well,
Yeah.
and I know just the reach that you guys have had with that. I mean, because I taught the clinical chemistry classes
Mhm.
online,
Yes, you did.
and I've had graduates really internationally from all areas of the world. I mean, we even had Middle East students.
Mhm.
We had a ton from the Pacific Islands as well.
We
We've had
did.
a lot from there.
Yeah. And
Um,
we have, oh, well, we had Hungary too. I remember students in different places. It's been great. And we were kind of like role model to other MLS departments. I know Cincinnati has grown bigger than us right now, but we were the first ones to help them.
yeah,
So, and that's a great thing to
you're
share what you can do.
well,
And
yeah, you earn your title as a trailblazer.
oh,
Mhm.
thanks.
You bet.
Yeah.
So I was wondering, uh, as we see the kind of the transformative power of education on medical students, and all of us physicians have seen that kind of growth in ourselves. But what is kind of the secret sauce or the secret recipe for you in helping to develop a a budding pre-med student, say at Weber State, who then wants to go on to medical school and become a physician? What's your secret sauce for that?
Um, I think all the students, especially the medical students, the pre-meds, um, need to know that somebody cares for them. They need to know that what they do affects so much the health of a patient. What you do with them requires a lot of education, requires uh, practice, and requires um, care. Required, there sometimes you have a patient that comes to see you, and that you're the only outside person that they get to tell their secrets. They tell you their ailments, and you need to be there for them. But we practice that when you're a student and you're working hard at nights and then coming to school in the day. And especially around here, we have families. Our students have multiple roles. They have the family person, they have jobs, and they have to provide to go to school. So when they know they have someone they can come to, they can share and know that somebody cares for them. Um, and you learn the listening techniques. You listen, you share, and you care. So I think that if all the students understand that, it carries them on to being better physicians, better healthcare providers. That's what
I,
I think my sauce is.
I agree with that. I think, with between my friends and I, were all trained by you in medical laboratory sciences, I think we would all agree that we have taken an element of that personal care and that individual just love for the person that you're talking to,
Mm.
um, and carried that over into clinical medicine, and that's made us better physicians.
Yeah,
So
you have to look at
I would agree.
everybody in all dimensions, not just studying, not just, but then they have other things. What's what makes them tick? And if, sometimes if someone comes in with an ailment, maybe the ailment isn't just the only thing. There's more things around them in their environment that helps them get better, but they're not having that, like especially I've worked with patients with asthma, and sometimes they're not doing well. And the problem is not their asthma, it's what's causing them to have stress and what's causing them with other things that you need to be able to see the fourth dimension. And listening and watching them when they're talking to you tells you that.
It's a very clinical way to look at your students. Love
Yeah.
it.
Yeah. Yeah, I remember that. You know, being in healthcare, you look at a patient or you look at everybody. I used to check my dad out, make sure his color was good, he was okay. I would look at him and he said, "Don't look at me like that." You know, I would check and see if he's pale. I look at his eyes to make sure uh, the conjunctiva, you know, I mean, you look at a whole person, and that's what I think it's important as a physician to do that.
Right on. Now, what is a now when you teach students or you guide the instruction of the students in the whole campus. Because I think when I was there, uh, you know, it just continues to grow. Um,
Mhm.
what I guess what would you have? What would you say that your greatest success was um, at Weber State University as dean of the College of Health Professions?
I think um, knowing what the needs of the healthcare community is, knowing what the needs that the regular community has, listening to what the requests are, um, and trying to meet the needs that is out there. All of our programs have advisory boards, and majority of the members on the boards are people who hire our graduates. The CEO of hospitals, the clinicals, they tell us what their needs are. And we assess, we evaluate how our graduates are doing. And then we go, and if for years, they've been asking for a PA program. Our community has asked. For years, they've been asking for additional students in nursing. For years, we've had needs to do all different programs. So listening to what the needs are, and then trying to bring funds, uh, because you can't do things without funding, and also representing what our needs are to administration. So having great supportive administration, having wonderful partners in healthcare, and listening what we can do and what we can't do is what I think contributes to the success we have had by increasing our offerings and bringing in, involving our graduates back into they're paying forward like you are doing right now. So it takes the village, it takes the whole, globe to assess things that are needed.
Yeah.
So,
Yeah, and I'm noticing kind of with that comment, something really interesting is that, you know, as physicians, we and all the listeners are out there and we are in essence, I mean, even if we didn't go to Weber State University and we don't work with any other physicians who learned at Weber State University, we're still dependent upon a lot of ancillary staff and nurses who all got trained at Weber State University.
yeah.
And so you know, there is a big, I guess, an unspoken respect there from what the work that you're engaging in. Um, but what is it that you would see any I don't know, not an ask, but like what is it that a physician could do to help you to create better nurse anesthetists or create better nurse PAs or create better nurses or respiratory therapists? What would a physician be able to do in that position?
When there's several things. First, we need funding to bring in state-of-the-art equipment that the student will get used to using if that's what you use in the hospitals and clinics. So being able to provide state-of-the-art equipment. And the next thing is the clinical rotations. If we have the opportunity to have our students work with you and see what you do and get used to that, then in a way you're interviewing them and you can hire them after. And so what we can do is provide fundings any way we can, provide clinical rotation abilities, and shadowing is what they need to see. And also talk to us about what else we can do. If you see needs that we're not meeting, it's very important that it's communicated to us so we can improve and we have the best of the best. And that's what we aim for. And communication is a big part of that. So that's what we need.
Okay. I think we can do that.
Yeah.
Val, I just realized I've talked for the whole first 30 minutes.
Yes, you have.
Sorry. I was so excited for yes.
Oh, I'm excited to say all these things. It's so easy to show off with what we do. It's easy to say, people wait for our graduates in our community. And I'm so proud of all of them. Like I told you, I was proud of you. And I'm happy with Dr. Johnson's help. He's been there for years. We have a scholarship in his father's name in medical laboratory sciences. And I'm so honored that I knew him.
Val Johnson, I went to Weber College, in 1960 and 61 when there were 2,000 students there. And it seemed like you knew most of the students and you knew most of the faculty at the college because it was a 2-year college then.
Mm-hmm.
But if that was a wonderful experience for me, because in a way at that time it was kind of a transition coming out of high school into higher education, and still being able to live at home and have some of the comfort of your own community and your family while you made that change from high school into college. Now I have some questions of Dr. Simonian. I had the opportunity, and I don't know when, 20 years ago, I can't remember how long,
It
when I
was a
was
long
able,
time.
I
I've
was
been at Weber State for 45 years.
well, I know, but I was able to come up and meet Dr. Simonian and work with her in laboratory sciences, giving a lecture once or twice a year was all. But that was a great opportunity for me as I was going to say a practicing physician. No, I'm going to change that in just a minute, and you'll see what I mean. But being a working physician to come up and be involved with the students and get in on some of the education teaching part, which was fun also. But I think that's what physicians are a little used to. I mean, they've had a long education and they have to educate their patients about things when they see them every day. And so it was good for me as a pathologist to be able to interact with these students. Now, I have some questions. People will often now I'm kind of known for saying some inappropriate things sometimes, and this might be kind of inappropriate, but I mean, if we have to edit it out, we will, but I don't think we will. But
I'm okay with
but
everything that you can handle.
but people, as a pathologist, many people don't know what a pathologist is, for example, because a lot of the people are too young to have watched the old Quincy television series with Jack Klugman as a pathologist and medical examiner and so on. So they don't know. And so they will often ask me and say, well, what kind of a doctor are you? And I will usually answer to begin with, a damn good one. And, and so if you have to edit that out, go ahead and do it. And then they say, well, what do you practice? And then I will often say, what do you mean? I don't practice medicine. I actually do it. And so those are, anyway, those are just a couple of standard comments that I often use because, yes, in science and in medicine, we do practice some things. We go to school, we learn about something, we go as an assistant into an operating room where we're with someone with experience, and he says, okay, now you do this, you cut that over there, you suture this, and that's where we begin to practice what we're going to ultimately do for real with real patients. In any event, I had a couple of questions. We have a PA, a physician assistant program up at Weber now. Now,
Yes,
is that within the health? Now, I know that at Weber, there is a little division of labor or education. Medical laboratory sciences and health sciences has a large, huge part. But the Department of Science has also involvement with, I think, the pre-medical students as well. So the PA program, is that within your department? Yeah.
yes. PA, physician assistant medicine, is part of our health professions departments. I waited 12 years to bring that in. I worked hard and we lobbied and raised funds to be able to, and that all became evident to us because I wrote so many letters of recommendation for our graduates to go to PA school. And I said, why don't we have one ourselves? Because so, and it happened. And next Friday, we're graduating the second cohort of PA students. And so I'm very proud of it. And we work hard with the College of Science, College of Health Professions, and College of Science, work well together for pre-meds. We have advisors that work with each other. And because we get along, we have increased or higher than average of our students being accepted to medical school, to PA schools, to graduate schools. So we need each other to make sure our students are well prepared. So that's one of them.
That is very good. The next thing I wanted to inquire about was Weber State University seems to have much involvement with the community. Now,
Mhm.
what I'm going to refer to specifically here is the School of Nursing at Weber,
Mhm.
which is outstanding and has national recognition. And I think we are all very, very proud of. Now, with that, you have involvement, I believe, with the Ogden Weber Technical College.
Yes, we do.
In their school, they have a school of nursing also. Now, it is not as, it does not produce the advanced nursing degrees that Weber does, but it has a very active program, and Weber is involved. Tell us about that.
We have not only the Ogden Weber technology, um, we also have Davis and Davis Technical College and Bridgerland in Ogden. I mean, in Logan. We work with all of them. We work with their students and the faculty, and they get their LPN, and then they come. They get the first year, and then they are transferred into a Weber. We have, as we call this career ladder, we have associate degree, ADN, we have MSN, and then we have Doctor of Nurse Practice in our School of Nursing, which is in College of Health Professions. And under the Doctor of Nursing, Nurse Practice, DNP, we have psych nursing, we have education, we have management, we have FMP, family nurse practice, many different levels. So that's why we have many nursing students in various levels. So we work with all the tech colleges, the 3 tech colleges at the moment, and our faculty work well with theirs and their students.
Thank you.
Mhm.
Back to you, Scott.
Well, thank you, Val. So we've been through what us as physicians can do to help you.
Mhm.
We've kind of gone over what you do in the community, which helps us as physicians. We've gone through what you do for physicians. I guess is there any other thing that I'm forgetting about to mention?
I think one of the things that I would like some help with,
Yeah.
in one of the things, one of my things in my job position is to raise funds. And it's important that the community knows about Weber State, especially College of Health Professions and all the departments that we have, in order to bring in the best to you, other than having wonderful faculty that get continuing education and have great physicians and healthcare providers that can be role models to our students, we need money. And if everybody chipped in a little bit, it will be a lot. As they say, drops of water makes an ocean. So, but if you don't have the ability to do the water, you can introduce us to people who can. And people who need to know what we do, because being able to produce, as I say, the best of the best, we need variables, so many different things to make it happen. So we need your brain, and you need your connections, and we need the funds. That's what is important to us. And also communication of what else you need, so we can be there for you. So it's a win-win with together when we work together, when we partner. How's that?
No, I love that. Well, and that you've made it so clear. It's kind of the full circle because, if we can help you as well, then you train
Yeah.
people that help us, and you even train us. So
And who benefits from all this is our community,
the whole community.
the whole community, because we will be there for them.
It's perfect. That's a perfect way to end this, I think.
So
Oh,
thank you so much for the opportunity. I'm so glad to see you both and be a part of this. And thank you, Teresa, for all the things you do and take care of all the physicians with the Ogden Surgical and Medical Society. You've been there for many years with us. Appreciate that.
well, and yes, thank you again. For me, from
My
the bottom
pleasure.
of my heart, you have positively influenced my life more than I can repay. So I'll just pay it forward.
I'm honored, and happy holidays to you, and stay healthy and as long as you can.
Thank you. You
Good
too.
to see you.
Good to
Thank
see
you.
Thank you, Yaz.
Thank you. See ya.
Thank you for listening to our podcast. This episode was produced by Clark Madsen, Teresa Pasquedra, and the board of the Ogden Surgical Medical Society. Our executive director is Teresa Pasquedra. Editing and sound design were provided by Eli Whittier with the support of the members of the Ogden Surgical Medical Society. Thanks again for joining us, and we'll see you next time.